$700. That is a conservative estimate of what the average American over 65 is handing over every single year, quietly, without complaint, for services they are either legally entitled to receive free or entitled to have waived simply by asking. Some of it goes to tax preparers who charge fees when free help exists. Some of it goes to banks collecting monthly maintenance charges that evaporate the moment you mention your age. Some of it goes to a Medicare wellness visit that is covered at zero cost under federal law, but gets billed anyway because the doctor's office coded it wrong and nobody caught it. $700. On a fixed income, that is a heating bill. That is 3 months of groceries. That is real. My name is William Hayes. For more than 20 years, I have helped retirees stop paying for things they are entitled to get for free or have waived. I am an enrolled agent, which means I am federally licensed to represent taxpayers before the IRS. I also work as a senior benefits advocate, which means I sit at kitchen tables with people who have spent their whole lives doing everything right and are now, in retirement, getting nickeled and dimed by systems that count on them not knowing the rules. Today I am going to walk you through 7 of these one at a time in plain English, with the exact thing you need to ask for on each one. Stay with me to the end, because the 7th is the highest value of them all and the easiest to claim. Before I do, hit that subscribe button. I put out 1 video a week, no fluff, just the rules as they actually work, for people who are actually living on Social Security and a pension and need the truth, not a sales pitch. The first thing I hear when I bring up any of these programs is, "William, I can afford it." And I understand that instinct. Nobody wants to feel like they are scraping. Nobody wants to raise their hand and say they need help. But I want to push back on that, because this is not about need, this is about what you earned. You paid into Medicare for decades. The annual wellness visit being free is not charity. It is part of the benefit you paid for. The TCE program, Tax Counseling for the Elderly, exists because Congress decided in 1978 that older Americans who spent their careers paying taxes deserve free help navigating the system on the way out. The Lifeline discount on your phone bill is a federal subsidy tied to income, yes, but 60% of the seniors who qualify never claim it. Not because they do not need it, because nobody told them. That is the first myth. The second myth is worse. This is only for low-income people. I hear this constantly, and it stops people cold. Some of these programs do have income thresholds. Lifeline does. The TCE program does prioritize lower incomes, though it serves anyone 60 or older regardless of what they make. But several of the items on this list have no income test at all. 0. The Medicare Wellness Visit has no copay for every Medicare beneficiary in the country, rich or poor. The free credit freeze applies to everyone. The replacement Medicare card is free for every single person enrolled in Medicare. No exceptions. No income limit. So before you assume you do not qualify, let me show you what the rules actually say. Because the myth that these programs are for other people is exactly what leaves money on the table, and it leaves it there year after year. Number 1. The Medicare Annual Wellness Visit. No copay, no deductible. Every year. Under Medicare Part B, you are entitled to 1 annual wellness visit every 12 months at absolutely no charge to you. No copay, no coinsurance, no deductible. Gov. The visit covers a health risk assessment, a review of your medications, and the development of a personalized prevention plan. It is not a physical exam in the traditional sense, which matters, and I will come back to that in a moment. The dollar impact. If you are being charged a copay for this visit, you are paying somewhere between $25 and $75 for something that should cost you nothing. Multiply that over several years, and you understand why this is item number 1. Who qualifies? Any Medicare Part B beneficiary who has had Part B for at least 12 months. That is it. Gov and search Annual Wellness Visit, or call 1-800-MEDICARE. That is 1-800-633-4227. Here is the detail nobody mentions. The billing code matters enormously. The annual wellness visit is billed under code G0439 for returning patients and G0438 for a first visit. If your doctor's office accidentally bills it as a regular office visit under a standard evaluation and management code, Medicare applies your deductible and cost sharing. It happens constantly. If you were billed incorrectly in a prior year, you have the right to appeal. Ask the doctor's office to correct the billing code and resubmit to Medicare. Number 2. Free tax preparation. Never pay a preparer if you qualify. The IRS runs 2 programs that provide free federal tax return preparation for seniors. The first is VITA, Volunteer Income Tax Assistance. The second, and the one focused specifically on people our age, is TCE, Tax Counseling for the Elderly. TCE is specifically authorized for taxpayers 60 and older, with a particular emphasis on pension and retirement income questions. According to the IRS, most TCE sites are operated by the AARP Foundation's Tax Aid program. In the 2025 filing season, AARP Tax Aid helped more than 2 million people file their returns at no charge. 2 million. The dollar impact, the average tax preparation fee at a commercial preparer, ran over $220 in 2025 for a standard federal return. If you are paying that fee and you are 60 or older, there is a strong chance you do not need to. Who qualifies? TCE serves anyone 60 and older. Income is not a disqualifying factor at most sites, though some sites prioritize lower incomes. bad.org/taxaid or call 8882-277-669. Sites are typically open January through April. Use the AARP site locator to find a location near you: libraries, community centers, senior centers. The detail nobody mentions: these volunteers are IRS certified. They receive specific training on Social Security taxation, pension income, and required minimum distributions. For most seniors with straightforward returns, the quality of help you get here is equivalent to what you would pay $200 for at a chain tax office. Number 3. Free Medicare counseling through SHIP. Never pay a Medicare advisor. The SHIP program, State Health Insurance Assistance Program, is a federally funded, state-operated network of trained volunteer counselors who will sit down with you, one-on-one, and help you with any Medicare question you have, comparing Part D drug plans, understanding your explanation of benefits, filing an appeal, switching from original Medicare to a Medicare Advantage plan, or back, checking whether you qualify for the extra help low-income subsidy on prescriptions. The dollar impact. Financial advisors and insurance agents who market themselves as Medicare specialists often charge consultation fees ranging from $150 to $500 per session, or they earn commissions that may or may not align with your best interest. SHIP counselors are prohibited from selling anything. They have no financial stake in what you choose. The advice is completely neutral, and it is completely free. Who qualifies? Any Medicare beneficiary or their family member or caregiver. No income limit, no age minimum beyond Medicare eligibility. The exact program. Call 877-839-2675 and say Medicare when prompted, or to find your state's SHIP office directly. The detail nobody mentions. SHIP counselors can go back through your explanation of benefit statements and flag billing errors. I have seen cases where a counselor helped a client recover several $100s in wrongly billed charges just by reviewing the past year's paperwork. That is not advertised anywhere. Number 4. Free replacement Medicare card. If your Medicare card is lost, damaged, or stolen, a replacement is free. Full stop. There is no fee to replace it. Gov/My account by phone at 1-800-772-1213 or at your local Social Security office. The dollar impact. Scammers and some third-party services charge seniors anywhere from $10 to $50 to help them get a replacement Medicare card. This is pure fraud. The card is free. The process takes minutes online. Who qualifies? Every Medicare enrollee. The detail nobody mentions. Since 2019, Medicare cards no longer display your Social Security number. They use a unique Medicare beneficiary identifier instead. If someone contacts you and says you need to pay to get the new card, or that your old card is being deactivated, that is a scam. Hang up. Number 5. Bank fee waivers for customers 65 and older. Many banks, including several of the largest national banks, offer accounts specifically designed for customers 62, 65, or older that come with no monthly maintenance fee, no paper statement fee, and sometimes reduced or waived overdraft fees. These accounts exist. They are not hidden, but they are not advertised loudly either. The dollar impact. The average monthly maintenance fee on a standard checking account runs between $12 and $25 per month. Over a year, that is $144 to $300 quietly leaving your account. Some banks also charge $2 to $3 per month for paper statements. Those add up. Who qualifies? This varies by bank. Many programs start at age 62 or 65. There is no income test. The exact program. There is no single national program here. This is bank by bank. Call the customer service number on the back of your card and say, "I am 65. Do you offer a senior checking account or fee waivers for customers my age?" That last part matters. Even at banks without a formal senior program, a direct request to waive the fee succeeds more often than people expect. Write down the name of the representative you speak with and ask for a written confirmation. The detail nobody mentions. If your bank says no, that is useful information. It may be time to look at a credit union, which typically charges lower fees across the board and often has senior-friendly account structures. Number 6. Free credit freeze and free annual credit reports. Under the Economic Growth, Regulatory Relief, and Consumer Protection Act, placing a credit freeze, also called a security freeze, at all three major credit bureaus is completely free. Lifting it is free. Removing it is free. This has been federal law since 2018. A credit freeze prevents anyone from opening a new line of credit in your name without your knowledge. For seniors, who are the most targeted group for identity theft and new account fraud, this is one of the most protective steps available. The dollar impact. Before 2018, bureaus charged up to $10 per freeze per bureau. Today it is $0. The only site authorized by the Federal Trade Commission provides free access to your credit reports from Equifax, Experian, and TransUnion. As of 2026, Equifax is also offering up to 6 additional free reports per year on that same site. Anyone charging you for a credit report or a credit freeze is taking your money for something that is free. Who qualifies? Every American. No age requirement, no income requirement. .com for your reports. .com. Each has a credit freeze section on their website, or you can call them. Gov has a step-by-step guide. The detail. Nobody mentions. Freeze all three bureaus, not just one. Each bureau operates independently. A freeze at Equifax does not protect your Experian file. Number 7. $25 off your phone or internet bill every month. This is the one I said to stay for, and here is why. Most of the items on this list require one phone call or one form. This one puts money back in your pocket every single month automatically once you are enrolled. .org. $25 per month on your phone service, your internet service, or a bundled plan. $25 per month. 25 times 12 months is $111 per year. That is money that stays in your account without you doing anything after the initial enrollment. Who qualifies? Households with income at or below 135% of the federal poverty guidelines. For a single person in the contiguous 48 states in 2026, that threshold is approximately $21.546 per year. You also qualify automatically if you or someone in your household participates in Medicaid, SNAP, Supplemental Security Income, Federal Public Housing Assistance, or the Veterans Pension and Survivors Benefit Program. Many retirees on Social Security alone fall within or near these income brackets. Allward to check eligibility and apply. You can also call your phone or internet provider and ask them directly whether they participate in Lifeline. The detail nobody mentions. The Social Security Administration confirmed in early 2026 that SSI recipients are automatically eligible for Lifeline. If you receive SSI, you qualify. The program is one provider per household, and the benefit transfers if you switch carriers. You do not lose it. Now let me tell you about Walter. Walter is a 70-year-old retired machinist. He lives outside of Cleveland, Ohio, and he came to me about 18 months ago. His daughter had seen something online about the Medicare wellness visit and asked me to look at his situation. When I sat down with him, I asked him to pull out his Medicare statements, his bank statements, and his last 2 tax returns. What I found took about 45 minutes to uncover, and it was not unusual. Not in the slightest. He was being charged a copay of $45 each time. The visit was being billed as an office visit, not an annual wellness visit. One phone call to the doctor's office to correct the billing code, and that charge went away going forward. Walter had been paying a tax preparer $195 every spring to file a return that consisted of Social Security income and a small pension. His income was well within the range that AARP Tax Aid handles free of charge. He had no idea the program existed. $95 a month in maintenance fees on his checking account. He had been a customer at that bank for 19 years. When his daughter called and asked whether they offered a senior account, the representative paused, looked at his record, and waived the fee on the spot. No argument. No negotiation. Walter's phone bill included a $42 monthly charge. He qualified for Lifeline based on his income. His provider participated in the program. He enrolled and his bill dropped. When we added it up, the corrected Medicare billing saved him $45 a year. The free tax preparation saved him $195. 40. Lifeline saved him $111. 40 per year. 85. Walter is a composite. The identifying details are changed to protect his privacy. But the dollar figures and the pattern are real. I see it constantly. Now I want to talk about something that people overlook. Some of what you have been paying can be recovered backward. The Medicare annual wellness visit billing error is one where you have real recourse. If you were charged a copay or a deductible for a visit that should have been billed as an annual wellness visit, you can ask the provider to correct and resubmit the claim. Medicare allows claims to be corrected and resubmitted. If the provider refuses, you can file a Medicare appeal. The appeal process starts with a redetermination request. You have 120 days from the date of the initial claim decision to file. Call 1-800-633-4227 to start. Bank fees are often reversible on request, especially if you are a long-standing customer. Most banks will credit back 1 to 3 months of fees when asked directly. The worst they can say is no. In my experience, a straightforward, polite request works more than half the time. The SHIP program can help you review past explanation of benefit statements going back 1 to 2 years. If a counselor spots a billing error, a service billed at the wrong rate, a duplicate charge, a service that should have been covered under preventative care, they can help you file a retroactive claim or appeal. This does not happen automatically. You have to ask your counselor to do this review. For AARP Tax Aid, if you paid a preparer in prior years for returns you could have filed free, that money is gone. But going forward, you stop losing it. Some clients also discover through TCE that they missed a deduction or credit in a prior year and can file an amended return, a 1040X, for up to 3 years back. The standard deduction for seniors over 65 has additional amounts built in. If a prior preparer missed that, an amended return could generate a refund. Lifeline enrollment applies from the date you are approved. There is no retroactive credit for months you were eligible but not enrolled. Another reason to act this week. Here is exactly what I want you to do in the next 7 days. Day 1. Call your bank. Say these words. I am over 65. Do you offer a senior account with no monthly maintenance fee? Write down the rep's name. Ask for confirmation in writing or by email. Day 2. Call your doctor's office and ask how your next annual visit will be billed. If they say they already do this, ask them to confirm in writing in your chart notes. .org or call 877-83-92675. Ask to speak with a SHIP counselor in your state. Book the appointment. When you speak with them, ask them to do a full review of your last 12 months of Medicare statements for billing errors. Pull your reports from all 3 bureaus, and place a free security freeze on each one. It takes about 15 minutes per bureau. .org/lifeline. Check whether you or your household qualifies for the Lifeline discount. If you do, apply online or call your phone or internet provider and ask them to apply it to your account. .org/taxaid. Bookmark it now. When the filing season opens in January, find a site near you and make an appointment. Stop paying a tax preparer if you qualify for free help. Day 7. Rest. You just did more for your financial situation in 6 days than most people do in 6 years. This is general education, not personal legal, tax, or financial advice. These rules really do vary by state and by income. Always confirm your own situation with your county, your state SHIP office, the IRS, or a qualified professional before you act. Being legally entitled and actually having the money are two different things. The only bridge between them is the form, and the agencies are not going to build it for you. So we will. If this was useful, share it with one person over 65 who you think is paying for something they should not be. That is the only ask I have. And if you want to know about the new 2025 senior deduction that quietly makes Social Security income tax-free for many retirees at 65, that is the next video. Do not miss it.